Did you know that 7 out of 10 Americans who have medical bills say that they have to lower their spending on food in order to avoid a medical bankruptcy? Navigating our highly complex world of healthcare and health benefits leaves many people feeling like a snowball in, well, you know where. I'm Josh Butler, healthcare consultant and advisor to more than 150 employers around the country, and this is A Snowball's Chance in Healthcare, a show about restoring hope in healthcare. Join us as we discuss ways you can lower your healthcare and benefits costs, how companies are winning the healthcare and benefits battle, and how hope is being restored to this community and communities across the country. Hello again, and welcome to another episode of A Snowball's Chance in Healthcare. My name is Josh Butler, your host, and I'm also the president of Butler Benefits and Consulting. We are a boutique healthcare consulting and brokerage firm located right here in the heart of the Texas Panhandle, place we call home, Amarillo, Texas. Love this part of the country. And each and every week we are discussing topics in healthcare that people find to be pretty frustrating: rising cost of healthcare, access issues. We interview some really amazing people, and I just got back from an industry conference in Denver this past week. It was the biannual conference for the Health Rosetta. We're going to be talking more about the Health Rosetta later, and actually next week we got a very special guest. The co-founder of Health Rosetta, Dave Chase, will be joining me on the program to discuss some really amazing things. I always love going and attending the Health Rosetta conferences because it's an opportunity for a lot of consultants and healthcare stakeholders to get together and talk about the most innovative things that are taking place inside this industry from coast to coast. And we're doing some really amazing things here in Amarillo and in the Texas Panhandle, but I'm excited today to talk a little bit more about that and to kind of share with what's going on around the country. And Dave Chase will be here next week to have a discussion about Health Rosetta as an organization. And so this week I want to spend a little time, I want to do something a little different. After attending this year's conference in Denver, which was last week, had a great time, got to hear so many inspiring stories from around the country that it inspired me to kind of write a letter or pen a call to action for our community, the Texas Panhandle, and specifically our community leaders and our civic leaders, our elected officials. And so today I want to share that letter because I will be publishing this letter on our website. I'll probably write a blog about it, but I'm also going to share it directly with all of the leaders in our community. And so I've addressed it and it's an open letter to the city of Amarillo, the city of Canyon, Potter County, and Randall County, and our economic development corporations in Amarillo and Canyon, because today it's a call to action about what's going on in healthcare and the movement that's afoot, and how we feel that healthcare is single-handedly the biggest opportunity for economic expansion, community to community, not just here in the Texas Panhandle, but everywhere in the United States. And so today I kind of want to share this letter, and I'm going to share a little bit of a commentary as we go along, and love to get some feedback on this from you. But basically, like I said, I'm addressing this letter to the cities of Amarillo and Canyon, Potter and Randall counties, and our economic development corporations in both Amarillo and Canyon. And it first starts out like this. Congratulations. First, I want to congratulate everybody that has played a part in our community's success over these past few years. The Amarillo area is growing, it's fueling more jobs, it's attracting more businesses, and those are great things. Our tax base is still really good and our taxes are low, and these are all great things for people in the Texas Panhandle and for the quality of life here on the High Plains. And so I just want to encourage our city leaders to keep up the good work and keep being aggressive. And I watch very, very closely. As many of you know, I watch our city and our counties very, very closely. And I just want to applaud our city leaders and our civic leaders in the area for our economic growth and expansion. And I'm sure that most of you read or you have read the financial reports that Amarillo National Bank publishes from time to time. And I've provided a link in the letter here for people to reference, and we'll post this on our website as well. but they're economic reports from Amarillo National Bank that I linked in here. And in each of these reports, one of the figures that's always shown is the total workforce population in Amarillo. And according to the July 2022 report, there's approximately 130,000 people that are actively employed and working in our local workforce. 130,000 people. Now, that's a key figure, and I'm going to come back to that figure here in a few minutes. Just remember, where there's about 130,000 people that are actively in our local workforce. Now, I mentioned I want to talk about healthcare being one of the biggest opportunities for economic expansion everywhere, not just here. As many of us have experienced in our lives and in our businesses, some of the greatest opportunities that we've ever come across have risen from adversity or facing setbacks or dealing with problems. And it certainly isn't front page news that there are major problems in healthcare. And we talk about many of those problems on this program. But what is less well known is the extent of the actual collateral damage that healthcare is playing in our society and in our local economy, and that the extent of that damage is less well known. Most people are, frankly, they're unaware of the financial pressures that drive our healthcare system, our status quo healthcare system, and how it is crushing the middle class in Amarillo, and it's crushing the middle class all across America. The middle class, and we cite many resources in this letter, many links and many publications and many studies that have been conducted to back this up. The middle class over the last 20 years has sustained wage stagnation. And now, due to rising or rapidly rising inflation, families are literally making daily decisions between necessary health care, things like taking their prescription drugs, and feeding their families. And there's a ton of data that backs all of this up. Well, one definition of an economic depression is 2 or more years of income decline. And after adjusting for inflation, the middle class in this country has seen a 20-year wage decline or stagnation. And largely, it's because of healthcare costs. It's not because employers are being stingy in the wages that they pay. In fact, they're doling out higher wages each and every year. But what we see commonly happen is those wage increases are quickly gobbled up with increases in healthcare costs and health insurance costs. Now, we've also, in conjunction with that, we've also seen another phenomena that we've talked about on this program. We've seen a massive transfer of risk over to working class people through things like high deductible health plans. Okay? Health insurance deductibles have risen twice as fast as wages every single year for the past decade. And let me be very clear, I've said this multiple times on this program. Higher deductibles do not lower the cost of health care for anybody. They merely shift health care costs over onto the workers. And when you're talking about people that maybe make $15 an hour or $18 an hour, the more and more you shift onto their plate, it has an adverse effect on people. This exposure to workers has also had a negative effect on their quality of life, their ability to save money, their ability to afford their kids' college tuitions, and even their ability to afford a more proactive and wellness-driven lifestyle. Because healthcare costs more for workers, they're simply delaying and foregoing routine and oftentimes necessary medical care. And as we all know, that leads to higher downstream costs. That leads to worse clinical outcomes. And this is the vicious cycle that we're talking about. This is the problem. Well, I want to tell you a quick story. Several years ago, a man and his wife came to my office to visit with me. And this man worked at a trucking company. He was a truck driver. And they had just become one of our newer clients. And we had implemented a new type of health plan in their organization. And in their meetings, I gave a very detailed description of how the plan would work for things like outpatient medical procedures, outpatient surgeries. And he was there to speak to me, he and his wife came to speak to me about his umbilical hernia. Now listen, ladies and gentlemen, this man had suffered a bulging umbilical hernia for 10 years. A decade this man suffered with this condition. And he and his wife shared stories about how they could never afford to get it repaired, despite the fact that they had health insurance. You see, in previous years, they had health insurance all right, but their individual deductible for him was $7,300, and it wouldn't cover anything until he had met his $7,300 deductible. And the wife went on to explain how multiple times over the years they would start out to try to save to meet that deductible money, but inevitably things would just happen. Life would happen. Just regular everything day things that happen in life. The car would need repairing, or the hot water heater would go out, or they had a child that turned 16 and they needed to buy a car. Just life happened. And you see, this family had delayed a very medically necessary procedure for this man for a decade, because they couldn't afford even their deductible on their health insurance. And for years, their employer, they just thought that they were doing what they had to keep their premiums down. They didn't give a whole lot of thought about the actual plan design. They were just looking for the lowest premiums. Now I sat there and I patiently listened to them tell their story and how this had caused so much stress and even embarrassment for this man for years. I mean, you can imagine. And this really hit me. This hit me like a ton of bricks, and it really had an impact on me because it was one of the first times that I really got to experience how so many people in this community right here are negatively affected by our healthcare system and how expensive it is. And there's so many stories like this out there. Well, after they wrapped up their story, I turned around at my desk and I picked up my office phone and I called a healthcare provider partner that we work very closely with in this community. And within 10 minutes, we had this man scheduled for a surgery. And the surgical repair would cost him $0 out of his own pocket. It would cost him nothing. And no deductible, no co-insurance, no co-pays, no anything. His employer had agreed to happily pay for the entire procedure. And we're going to talk about why here in just a second. But as they left my office, his wife gave me a hug and she had tears in her eyes. And she couldn't believe that after a decade, 10 years, he was going to get the quality care that he needed. And they weren't going to be financially burdened or financially strapped in order to do that. Now, the reason that the employer agreed to pay 100% for this procedure is because we got this procedure for $3,600. For years, this man had inquired and been quoted estimates anywhere from $14,000 to $23,000 just for the facility charges for his procedure. We got the whole thing done for $3,600 with a top surgeon right here in this community. Now, through most insurance plans, I can corroborate this man's research. That procedure would have been $14,000 to $17,000 anywhere. And we got it for $3,600. And because we did so, a week later, that man had his surgery, and today he's doing well. And we have dozens of stories just like this. Well, these types of custom health plans, like we placed in this man's company where he works, are driving down healthcare costs anywhere from 20 to 40% for employers and their employees. These types of health plans are being launched all over the United States, not just here in Amarillo, all over the U.S., and they're working. Employers that we work with are implementing these types of plans, and they are seeing, here's the figure. I did an analysis on our clientele, on our book of business. They are experiencing a decrease of $3,000 per year per employee in their healthcare costs. $3,000 a year per employee. Now let's go back to the Amarillo National Bank study, and I told you there was 130,000 active workers in our community alone. And just theoretically, I know that this is probably not going to happen, but if every single employer in Amarillo would adopt a plan that would reduce healthcare costs $3,000 per employee per year, it would generate between $380 and $400 million a year in economic stimulus just by addressing out-of-control healthcare costs. So you city leaders, you county leaders, you civic leaders, you elected officials, imagine what our community would look like if we saved $400 million a year, if our local businesses, instead of paying it out in inflated healthcare charges or in waste or in fraudulent payments, it's $400 million a year just right here in our community. What kind of impact? And the beauty is this is being done in communities all across America, including with my own clients. right here in Amarillo, Texas. In East Tennessee, we are currently working with a large physicians association of more than 1,100 doctors to build a community health plan similar to the one that we've created here. And it's delivering a plan, and it's reducing healthcare costs, and it's delivering a plan to regional employers that boasts a $0 deductible, $0 copays for primary care, $0 for diagnostic imaging, and $0 for generic medications. Okay, now East Tennessee, folks, this is an area of the country where poverty is a big issue, and opioid addiction and drug and alcohol addiction are huge issues, and access to care. Think about how these types of plans are going to be able to impact the lives of people in these communities. In St. Louis, I've got a friend and a colleague who we just had on this program a couple of weeks ago. He worked closely with a large hospital system in St. Louis to build a plan very similar to what I'm describing here today. And it's changing people's lives. And it's capturing millions and millions of dollars that employers are having to pay in healthcare. Instead of paying it out to healthcare, they're retaining these dollars for their companies. Okay? Another friend and colleague of mine, that he lives in the Cleveland, Ohio area. He created a nurse navigation company for every public employer in his county. And guess what? They all do business with him now. The city, the county, the school districts, everybody, they're all his clients. Because they're achieving amazing results through these community health plans that he's built. Allegheny Schools in Pittsburgh, Rosen Hotels and Resorts in Florida. This is happening in pockets all over the United States. And so it's not a pipe dream, it's a reality. And like I said a minute ago, imagine what our community would look like if our local businesses were able to retain $400 million a year each and every year. Think of all the societal issues that could be better addressed: education, drug and alcohol addiction, poverty, crime, our city parks. Y'all remember when we had this whole deal about funding our city parks and repairing our city parks? Homelessness, access to health care, early childhood development, and so many other social determinants of health. Think about it. Also imagine that if this community came together to support a plan like this, what kind of recruiting tool it would be for our EDCs to attract new businesses to this area. Healthcare is a top P&L line item for all companies. So imagine the bargaining chip that it would be to tell a prospective corporation who's thinking about moving their headquarters and business here that there is a community health plan available that would drive down their healthcare costs 20 to 40% and improve the quality of the benefits they offer. It's absolutely a strategic advantage for communities. And if you don't believe that it's a strategic advantage for businesses, I'll tell you another quick story. 2 months ago, I lost one of my largest clients. I lost them. I lost them to an acquisition. They were acquired by a much larger corporation, so it was a little bittersweet for us. Obviously, it was a very large deal for this family to sell their company. It was a 9-figure acquisition deal, so congratulations to them. It was bittersweet because we lost a client, but we lost them, and acquisitions happen, and we just lost them. Well, after the acquisition, the owner of that company called me on the telephone to thank me for the services that we had provided for them over the past few years. And one of the things that he shared with me is that when the acquiring company was doing due diligence, they were really kind of shocked at what their healthcare expenditures were as an organization compared to other companies that they had acquired in the past. And so one thing that it did, because that company saved so much in healthcare over that time period, they were able to make investments in their company in different places, and that boosted that company's valuation. It made their company more attractive. It made their company more valuable, simply because they addressed healthcare in a meaningful way. They addressed it and managed it properly. And so that's why I say that healthcare is commonly overlooked as an economic stimulator and opportunity for companies in our economies. So we also know that healthcare is very local, okay? It's a major cornerstone of any thriving community. So a couple of years ago, some of you may recall that we raised money to purchase and eliminate medical debt right here in Potter and Randall counties. We did that a couple years ago. We raised money, and we successfully acquired and then eliminated over $1.5 million of local debt just right here in Amarillo. That campaign impacted more than 1,900 local residents. But guess what, folks? There's millions and millions and more dollars out there in medical debt right here in Potter and Randall County that's still outstanding. Thousands and thousands of people in this community still owe medical debt to this day. So we can't pretend like this is some kind of problem that happens in a faraway place and that it's happening in other communities and not ours. It's happening right here. It's burdening our middle class. It's crushing them in many, many ways. Well, I want to transition here a little bit because one of my favorite scriptures in the Bible comes from Luke 12:48. In Luke 12:48, many of you know this scripture, and it says, "To whom much is given, much will be required." And at Butler Benefits, I very much feel compelled to help as many people in this community as I can, as many businesses in this community as I can. Well, for the last several years, that's why we've been working on this initiative for Amarillo. It's why I started this radio program, because we're delivering results through a high-performing community health plan called High Plains Health Plan. High Plains Health Plan is lowering healthcare costs for employers and their employees, and it's vastly improving benefits in a lot of these companies. It's giving people hope. People like the man that had an umbilical hernia for 10 years and couldn't afford to get it fixed. People like the woman that we helped just last week who told me she wasn't going to fill her medication because she could not afford her $75 copay for that medication. A doctor who we visited with here recently, he shared with us that he has a patient that really needs to go see a specialist. He needs to go see a cardiologist, but this man won't follow up and go see the cardiologist. And it's because he can't afford his $75 copay to go see his cardiologist. $75 to that man is over a half a week of groceries. And so you see why so many people are avoiding and foregoing and delaying necessary medical care. Cost is the biggest hurdle when it comes to people accessing high-quality health care. But we're solving this problem for so many people. We can restore so much hope and so much in this community if we all came together to address one problem. It's health care, and work together to solve it. Now this week, I'm very proud to say that this week Butler Benefits is going to get recognized by the Chamber of Commerce as a top business in Amarillo. And I'm very honored and I'm very proud of my team and my wife over at Butler Benefits. We're very honored and humbled to be recognized for this award. But we weren't recognized for this award because we're really good at selling health insurance. That's not why, okay? When the committee came to interview me, when the committee from the chamber came, I didn't talk about how much insurance we sell or how many clients we have. I spoke about the problems that we all face as a community in healthcare today. I spoke about this initiative that we're working on, and I shared stories with them and how we're helping people in this community. Stories like the umbilical hernia and the high-cost medications. We do that for lots of people. I spoke about courageous employers that we work with that are rolling up their sleeves and they're beginning to do something about this problem. There's companies all over the U.S. that are they're the true heroes. They're making the decision to step out and do something a little bit different. I spoke about restoring hope in healthcare, and that's what High Plains Health Plan is about. The potential for a $400 million per year in economic stimulus is right here in Amarillo, and that opportunity's there, and it's hiding in broad daylight. Now that was the message that I wanted to send to our community leaders and our elected officials and our civic leaders. It's a call to action. It's not to necessarily, you don't have to work with me personally. It's just if you're a business owner in this community or a civic leader or an elected official and you want to talk to us about this initiative and what roles that each of us can play in this solution, call me. Come visit with me. I'm eager to find as many people possible that want to engage because we truly can change healthcare, and it's happening all over the United States. Now, we're going to expand on this a little bit more next week because a lot of this, these newer innovations and these high-performing community health plans are being aggregated through an organization called the Health Rosetta. And next week, the co-founder of Health Rosetta, Dave Chase, will join me and be my guest. And I've got some good questions for him, and he can explain a little bit further about how this thing looks in another 10 years and what our overall mission is to reform healthcare in this country. But that's going to do it for this week. I hope you'll share this episode with our community leaders and our civic leaders, because each week we're sharing stories and solutions and strategies to give you a snowball's chance in healthcare.